Corteza of BSRT 1B of St. Alexius College, and today I am going to perform the return demonstration of the medical hand washing. According to the World Health Organization, there are 5 moments of medical hand washing that we need to consider. First, we need to perform medical hand washing before touching the patient in order to protect them against acquiring harmful germs from the hand. Second, before any sterile or invasive procedure, it is necessary to do hand washing in order to protect the patient from potential pathogens from entering their body during a procedure. Third, after touching the patient. Fourth, after fluid exposure risk. And fifth, after touching the patient's surrounding in order to protect ourselves as well as the healthcare surrounding from being contaminated with pathogens. So when it comes to lowering the likelihood of infection transmission between the healthcare workers and the patient, hand hygiene is widely regarded as the most important step. The removal of transient microorganisms from the surface of the hand is the goal of the medical hand washing in the clinical setting. So in performing medical hand washing, the materials or equipment that we need to use includes the sink with warm water, antimicrobial soap, towel, or a paper towel or tissue will do. So we will now stand in front of our sink. So always bear in mind that our sink is a contaminated area. That is why we need to avoid touching it, as well as keeping contact with our uniform. So if we are wearing a long sleeve uniform, we must roll up our sleeves above our elbow, as well as removing all of our jewelry and watches. So we will now pick up the towel and place it on our left shoulder. Always bear in mind not to touch the inside and outside of the sink because it is a contaminated area. So we will now turn on the water and adjust the pressure or the temperature to warm. Then, we will thoroughly wet our hands and wrists into the running water. Our fingers should be pointing downwards, and always remember that our hands should be lower than our elbows so that the water runs from the least to the most contaminated area. Now, we will apply a good amount of antimicrobial soap and lather hand thoroughly together, counting 1, 2, 3, 4, 5 in a circular motion. So we will start from palm to palm. Next is palm to palm, fingers interlace. Then, right palm over dorsum and vice versa. Then, back of fingers to opposing palms, fingers interlocked. the rotation rotational motion of fingertips against the glass palm. Then, the rotational rubbing of the right and left thumb. Lastly, the rotational rubbing of the right and left wrist. Proceed to drying our hands using our towel. So in drying our hands, we will use the towel by holding the towel in the opposite hand and sewing an oscillating motion of the arm and drawing the towel up to the elbow. So carefully reverse the towel, still holding it away from our body. Then we will dry the opposite hand and arm on the unused end of our towel. So after drying, we will then put the towel on a plastic basin or hamper. So lastly, we will turn off the water using a dry paper towel or tissue if the faucet is hand operated because the faucet is a contaminated area. Then, we will discard this paper towel into the trash can.